Well, they are launching the What Canadians Need to Know About Their Medication report, and who better to talk about it than a doctor? And she also leads the Ottawa-based Rational Therapeutics and Medication Policy Research Group. She is Dr. Lise M with us today. Nice to see you.
Likewise.
You are also a family doctor. Let's see, is a clinician-investigator with the University of Ottawa Department of Family Medicine and the Bruyère Research Institute. So you're a pretty important lady.
It's important. My patients are important, and the work we do is important.
Well, you do important work. So tell us about the group, the RTMP.
So the RTMP, which is the Rational Therapeutics and Medication Policy Research Group, is a group of researchers in Ottawa across departments, institutions, universities. And what we have in common is that we all work towards improving medication access, information, and appropriate use of medication.
Okay, so how long has this group been around for at this point?
We're going into our 4th year now.
4th year. And how many people are in this group?
Oh, we're about 15 people.
15 people.
If people would like to have more information about it, we do have a website. It's called rationaltherapeutics.ca, and there's information about the researchers and about the work we do and various activities.
Okay, so this report, it's from the findings that were held, you got together, it was April of last year, and now the report is finally coming out?
That's right.
So what exactly is the report about?
So the report is about basically recommendations that groups of patient representatives as well as healthcare provider representatives from across the country, which we brought together in last April, have come up with. And it has to do with access to medication information, both for patients as well as for healthcare providers. And we basically have identified some gaps in medication information in Canada. On the patient side of things, for example, people are familiar, I think, with the sometimes multi-page small font handouts that we get when we go and get prescription medication at the pharmacy, and we feel there's a need for more simplified information. Some people may want the detailed information, but we feel there's a need to have much more simplified, sort of one-page, focusing on the essentials that people need to know.
Are you saying then perhaps that sometimes there's just too much information that's given out?
There certainly can be too much information. It can be overwhelming for people. I see that in my office when patients come, and there's a lot of uncertainty sometimes around what's really important, what should they watch out for, what do they need to do in terms of monitoring. Do I need to get my eyes checked when I'm on this medication? Those are things that don't necessarily stand out from the information that they're provided with.
Okay, so good medication information resources do exist, and so is that where we can find, one of the primary places to find the information would be at the website?
We don't ourselves provide clinical information. The website is about the work that we're doing, and as I said, there are good resources more for healthcare providers than for patients. The issue on the healthcare provider side of things is different. It's really a matter of having access to those resources, and that's an issue that people are most likely not aware of. But those medication information resources, which are really sort of a basic tool if you're practicing as a family doctor or nurse practitioner and prescribing medications, those resources are not paid for by the healthcare system. If you go to hospital and have surgery, the surgeon is not paying out of pocket for their scalpel and their suture material. If you go to your family doctor in the community, in many cases they have to pay out of pocket to have access to good healthcare professional level medication information, and we feel that's a gap that also needs to be addressed. So that's part of the recommendations that we make in the report. And there's examples in other countries where things are done differently, so I think we can improve what we're doing here in Canada. Okay,
so there's no standards in place right now to actually, what's the word, to hold people accountable for writing the proper information, or?
There are no sort of across the board agreed upon standards. Clearly there's a lot of commonalities in the various resources that exist. But you're right, there are no agreed upon standards. So that's one of the things that we're advocating for, is we need to sit down and talk about what needs to be included, particularly if those types of resources are to be funded by the healthcare system. We need to define what it is that we're going to be paying for, and so that our prescribers can have access universally across the board to some good, reliable information.
Is there a concern then that safe prescriptions are not being given? Is that one of the concerns here, or is it more just for awareness of what exactly the prescription is? It's
more for awareness of what the prescription is, but having good awareness both on the side of the patients who are using the medication and having access to the right information and universally without any financial barriers on the side of the prescribers. That's key to improving appropriate use of medication and to reducing possible adverse effects.
Okay, so now that the report is out, we have about a minute here. How do we fill those gaps? How do we fix the problems? What's the best way?
That's the $1 million
question. Can Canadians
go
help, or do you have to be in the healthcare field? Or
no, you don't have to be in the healthcare field. We work very closely with patient representatives. And there's more information about our various partners in the report, so if people want to go to rationaltherapeutics.ca and look into that, we're also happy to entertain inquiries. But that's the $1 million question, and our next stage is to get some funding to do a more in-depth analysis in terms of what's out there, both nationally as well as internationally, and to move forward to make recommendations that can be implemented so that we can work towards getting those resources and making them accessible.
All right, rationaltherapeutics.ca, the place to go to. We thank you very much, Dr. Lise Bjerre, for being here today. Appreciate your time. And we've got more Daytime coming up in moments right here on Rogers TV.